Bismillahirrahmanirrahim. The quote for the today is: there are no incurable diseases, only the lack of will. There are no worthless herbs, only the lack of knowledge. Today, the topic of discussion is occupational health and hazard, and I am giving this presentation under the kind supervision of Professor Dr. Saira Afzal. The learning outlines for today's presentation is historical background of occupational hazard and health, introduction of occupational health services, occupational medicine, health workers, occupational hazards, sickness, absenteeism, prevention and control of occupational diseases, international regulations, conclusion, recent updates, and all the MCQs. By the end of this presentation, participants would be able to describe the occupational health and hazards, their prevention, and their control. So, what is occupational health? Occupational health is the study of the effect of work and working environment on the health of the worker and influence of the state of health of the worker on his ability to perform the work for which he is employed. So the aims and objectives of occupational health, these are defined by a joint committee of International Labour Organization and World Health Organization in 1950, and it is defined as follows. Occupational health should aim at promotion and maintenance of highest degree of physical, mental, and social well-being of the workers in all occupations, the prevention among workers of departures from health caused by their working conditions, the protection of workers in their employment from the risk resulting from factors adverse to health, the placing and maintenance of the worker in an occupational environment adapted to his physiological and psychological acumen, and to summarize the adaptation of work to man and of each man to his job. Occupational health is application of preventive medicine in all places of employment. Preventive medicine and occupational health have the same aim, the prevention of disease and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. Its levels of application are health promotion, specific protection, early diagnosis and treatment, and disease limitation and rehabilitation. Now, the functions of the occupational health services. The functions are placing people in suitable work, maintaining people in suitable work, providing treatment, controlling recognized hazards, identifying unrecognized hazards, avoiding potential risks, screening for early evidence of non-occupational diseases, health education and safety training, surveillance of sanitary, catering and welfare amenities, environmental control outside the workplace. The organization of occupational health service and implementation of an occupational health program to carry out these functions depend on many factors such as the size and geographical location of the undertaking, the extent and the nature of the hazard associated with the work of undertaking, availability of resources, and relevant statutory requirements. For the occupational health, occupational medicine. In developed countries, occupational medicine has a special status within the general preventive medicine field. In our circumstances, it is not possible to maintain a separate status outside the community medicine, as we need to coordinate occupational health activities with the prevailing community health programs. The main responsibilities of a doctor working in industry are knowledge of the working environment, medical examination for general as well as occupational health surveillance, treatment services for illness and injury, health education, ability to assess and prevalence studies. So the health of the worker. Factors that can affect the health of the population also apply equally to industrial workers, that are housing, water, sewage, and water disposal, nutrition, and education. The aim of occupational health is to provide a safe occupational environment, to safeguard the health of the workers, and to increase industrial production. Healthcare is the fastest growing sector of the US economy, employing over 18 million workers. Women represent nearly 80% of the healthcare workforce. Healthcare workers face a wide range of hazards on the job, including sharp injuries, harmful exposures to chemicals and hazardous diseases, back injuries, latex allergy, violence, and stress. Although it is possible to prevent or reduce healthcare worker exposure to these hazards, healthcare workers continue to experience injuries and illness in their workplace. Cases of non-fatal occupational injury and illness with healthcare workers are among the highest of any industry sector. These are the occupational hazards that can affect any worker. These are the infectious agents, chemical hazard, physical hazard, then the risks related to the dentistry, home healthcare prevention, and they need prevention and control, work stress. Occupational environment. Occupational environment is the sum of external conditions and interactions which prevail at the place of work and have a bearing on the health of working population. And it includes man and physical, chemical, and biological agents, man and medicine, and man and man. No, man and physical, chemical, and biological agents. Physical agents. The physical agents are those that are adverse to health are heat, cold, humidity, air movement, heat radiation, light, noise, vibrations, and ionizing radiation. Factors act in different ways on health and efficiency of the worker, singly or different combinations. Amount of working and breathing space, toilet, washing, and bathroom facilities are important. Chemical agents comprise a large number of chemicals, toxic dust, and gases which are potential hazards to the health of the worker. Some chemical agents cause disabling respiratory illness, injuries to the skin, deleterious effect on the blood and other organs of the body. Biological agents, the workers may be exposed to virus, rickettsial, bacterial, and parasitic agents. Close contact with animals or their products, contaminated water, soil, or food. Number man and machine. Industry affecting implies the use of machines driven by power with emphasis on mass production. Unguarded machines for trading and moving parts, poor installation of plant, lack of safety measures are the causes of accidents. Long hours in unphysiological postures causes fatigue, backache, disease of joints and muscles, and impairment of workers' health and efficiency. Number man and man. Numerous psychological factors operate at place of work. These are human relationships among us workers themselves on the one hand and those in the authority over them on the other. Now, what are psychological factors? Time and rhythm work, work stability, service conditions, job satisfaction, leadership style, security, workers' participation, communication, systems of payment, welfare conditions, degree of uh, degree of responsibility. Occupational environment of the worker cannot be considered apart from his domestic environment. Both are complementary to each other. Ecological approach. Occupational health represents a dynamic equilibrium or adjustment between the industrial worker and occupational environment. Now the occupational hazards. And WHO categorization of occupational hazards are six that are physical, chemical, biological, ergonomic, psychosocial, and mechanical. So what are physical hazards? These can be lead to high temperature and low temperature, low pressure, vibration, light, noise, and non-ionizing radiation. So the effects of heat and cold. Common physical hazards in most industries. It causes direct effect as heat stroke, heat exhaustion, and heat cramp. Indirect effects are decreased efficiency, increased fatigue, and enhanced accident rates. Occupational exposure to extremely low temperature is experienced by divers, fishermen, dairy workers, refrigerators, and repairmen, and others. Important hazards associated with cold works are chilblains, crunch foot, and frostbite. General hypothermia is also common. Occupational exposure to extremely low temperature is experienced by divers, fishermen, dairy workers, refrigerators, and know the noise. Noise is a health hazard in many industries. The auditory effects are temporary, permanent hearing loss, and the non-auditory effects are nervousness, fatigue, interference with communication by speech, decreased efficiency, and annoyance. The degree of injury depends on intensity and frequency of pain, duration of exposure, and individual susceptibility. For the vibration, vibration frequency ranges from 10 to 500 Hz. Tools such as drills and hammers. Vibration usually affect the hands and arms. After some months or years of exposure, the fine blood vessels of the fingers may become increasingly sensitive to spasm. Exposure to vibration may also produce injuries of the joints of the hands and the shoulders. So the biological hazards. workers are exposed to infective and parasitic agents at the workplace, it may cause brucellosis, leptospirosis, anthrax, hydatidosis, tetanus, fungal infections such as schistosomiasis. Persons working among animal products and agriculture workers are especially exposed to biological hazards. Apart from this, the most common biological hazard that can occur to the workers are hepatitis B. Now the chemical hazard. The chemical hazard in various occupations can be due to gases, vapor, fumes, mist, dust, and others. The risk associated with the occupational exposure to gases was first shown in mines. Gases can cause damage due to asphyxiation, irritant action, toxic action, and necrotization. The gases that cause occupational health hazards are asphyxiation gases that are carbon monoxide, hydrogen sulfide. Irritant gases are ammonia chloride, sulfur dioxide. Toxic gases are arsine, and inert gases are methane and carbon monoxide, carbon dioxide. Know the mechanical hazard. And then are the psychosocial hazards. These can cause affect the health in the ways of frustration, lack of job satisfaction, insecurity, poor human relationship, and emotional tension. It's no the term is ergonomics. Ergonomics simply means fitting the job to the worker. Its objective is to achieve the best manual adjustment of man and his work for the improvement of human efficiency and well-being. Application of ergonomics has made significant contribution to reducing industrial accidents and to overall health and efficiency of the workers. The goal of ergonomics is to reduce WRMSDS, that is work-related musculoskeletal disorders. Other forms of WRMSDS are cumulative trauma disorders, repetitive strain injuries, overexertion injuries, and overuse syndrome. The WHO uses the term WRMSDS to characterize disorders that involve both personal and work-related factors that distinguishes them from occupational diseases where in the entire cause is by work exposure. Now, these are the classification of the occupational hazard that are physical, that are noise, vibration, radiation, lighting, heat, cold, fibers, and dust. Then are the biological hazard that can be caused by bacteria, fungi, insects, and viruses. Then are the chemical hazard that can be caused by fumes, gases, aerosols, mist, liquids, and vapor. Then the ergonomic uh, is the manual handling, repetitive movement, and restricted working area. And at the end are the psychological factors that can contribute to the health of the worker are job stress, job monotony, unsociable or and job organization. So the occupational diseases, pneumoconiosis. This is a special type of chemical hazard produced by occupational exposure to dust. These are categorized into two types: major pneumoconiosis and minor pneumoconiosis. Major are silicosis, asbestosis, and anthracosis, while the minors are bagasosis, dysinosis, and pharmazoam. We will discuss in detail further in the upcoming presentations. So, occupational cancer. It is a serious problem in industry. The sites of body most commonly affected are skin, lungs, bladder, and blood-forming organs. So, the control of industrial cancer. Elimination and control of industrial carcinogens. Technical measures like exclusion of carcinogen from the industry, well-designed machinery, closed system production, and others. No occupational hazard that are related to the agriculture workers. Occupational hazard in an agriculture sector is a new concept. Agriculture workers have a multitude of health problems, a fact which is often forgotten because of the widespread misconception that occupational health is mainly concerned with industry and industrialized countries. The hazard to which a worker in agriculture activities are exposed are physical hazards, chemical hazards, biological hazards, and accidents. So the accidents in industry. Accident is a common feature in most industries. In fact, some industries are known for accidents. For example, the most known of them are mining, especially the coal miners and the construction workers. It was estimated that nearly 3 million men are lost yearly due to industrial accidents. Causes are human and environmental, that include physical, psychological, and psychosocial and psychological factors. Environmental factors are temperature, poor illumination, humidity, noise, and unsafe machines. Unsafe machines account for 10 to 20% of all type of accidents. So, sickness absenteeism. Sickness absence is Important health problems in the industry. As the production techniques become more sophisticated, absenteeism tends to increase. Absenteeism is useful index in the industry to assess the state of health of the workers and their physical, mental, and social welfare. For the prevention and control of occupational diseases, uh, the, uh, the control is by three measures that are medical, engineering, and legislative measures. We will also discuss them in detail in the coming presentation. So the Pakistan Occupational Health and Safety Act, that is published in 2019. It is an act to ensure safe and healthy working conditions for the people at work by authorizing the enforcement of the rules and regulations developed under the Act, by assisting and encouraging the organizations, institutions, and geographic areas governed by federal government in their efforts to ensure healthy and safe working conditions, by providing for research, information, education, and training in the field of occupational health and safety. Now the international regulations. The first one is the OSHA guidelines, that are Occupational Safety and Health Administration guidelines. Then the second one is the Global Plan of Action on Workers' Health. Now the first one is the Occupational Safety and Health Administration. It is an agency of the United States Department of Labor. It was created by Congress under the Occupational Safety and Health Act signed by President Richard M. Nixon on December 19, 1970. Its mission is to prevent work-related injuries, illness, and death by issuing and enforcing rules called the Center for the Workplace Safety and Health. OSHA regulations provide hepatitis B immunization to employees without charge within 10 days of employment, require that universal precautions be observed to prevent contact with blood and other potentially infection material. Saliva is considered to be a blood-contaminated body fluid in relation to the dental treatments. Implement engineering controls to reduce production of contaminated spatter, mist, and aerosol. Implement work practice control precautions to minimize splashing, spatter, or contact of bare hands with contaminated substances. Provide facilities and instructions for washing hands after removing gloves and for washing skin immediately or as soon as possible for feasible after contact with blood or potentially infectious materials. Prescribe safe handling of needles and other sharp items. Now the Global Plan of Action on Workers' Health 2008 to 17. This plan links occupational health to public health by identifying the following objectives for global action. These are to drive implement policy instruments on workers' health, to protect and promote health at workplace, to improve the performance of and access to occupational health services, to provide and communicate evidence for action and practice, to incorporate workers' health into other policies. So the conclusion. The conclusion is that occupational health risks are present in every profession. With advent of advanced technology, no matter how beneficial it is, can exert a negative impact on some members of the population. The reality is to balance maximum benefit and minimum harm to the population and well-being. Once identified and recognized as risk, new guidelines, precautions, and protocols should be rapidly instituted to reduce or even eliminate the hazard. Application of economics and administrative measures contribute greatly in reducing the occupational hazard in professional groups. So time for the recent update. Labor policy of the government of Pakistan. Since creation of Pakistan, 5 labor policies have been announced by the government in the years 1955, 59, 69, 72, and the last one is in 2002. After 2002, no labor policy has been introduced, although a number of developments took place in the intervening period. Of all the previous policies, the labor policy of 1972 taken out was the most progressive one, which reformed the labor laws and set out new benchmarks. The government's vision for the new labor policy contents are entrenched in the four main guiding features. Like labor policy, like other policies in the field, should also aim in attaining the objectives in a manner best suited to resources of the country and to present state of the economy. There is an urgent need to revitalize the economy, required sustained efforts to increase the level of productivity, promotion of investment, and maximization of employment. The labor policy has accordingly been divided into four parts that are legal framework, advocacy, skill development and employment, and manpower and work. The second article is psychological effects of COVID-19 pandemic on healthcare workers globally, a systematic review. In this systematic review, they compared the incidence of psychological issues during COVID-19 pandemic, such as anxiety, depression, occupational stress, and post-traumatic stress disorder, and insomnia in healthcare workers and non-healthcare workers. They identified six studies out of the final 15 selected, which reported numerical estimates for incidence of psychological effects. Meta-analyses were conducted comparing between both combined and individual effect sizes of all psychological manifestations. Qualitative evidence was reported from remaining nine cross-section studies. The summary facts of the combined qualitative meta-analysis conducted on six studies did indicate near significant differences between healthcare workers and non-healthcare workers. Summary facts of individual manifestation indicated significantly higher incidence of insomnia among healthcare workers when compared to non-healthcare workers. Qualitative evidence from remaining cross-section studies provided additional information into the nature of the psychological issue. We conclude that even though reasons for psychological distress among healthcare workers and non-healthcare workers may be different, both suffered in equal measures excepting for insomnia. The time is for the MCQs. Factory workers in different types of factories are exposed to different hazards. Handling of dangerous tools in an occupation can be classified as whether physical hazards, chemical, biological, mechanical, or psychological. Handling of dangerous tools. Under which heading does it come? These are the mechanical hazards. Handling that are related to the handling of dangerous tools like sharps and other injuries. Second MCQ is administration of hospital XYZ is very much concerned about the safety and health of healthcare workers. Most prevalent occupational health hazard to health question is whether hepatitis B, cancer, malaria, tuberculosis, or TB. It's hepatitis B. Management Authority of CTXYZ has allocated a risk is a task to do amendments to reduce the air pollution, to reduce lead elimination from the automotive, to reduce the lead elimination from the automobile in the environment. The best way is by legislation, environmental monitoring, dust suppression, substitution, or by advocacy. It is by substitution. Fatty worker came to the hospital with complaint of an issue in hearing from last 6 months. Both aspects of prevention of noise and induced hearing loss in practice is enclosing noise source, use earmuffs, use less vibrant material, enclosing operator in soundproof booths, and play music in background. It's B.
B.
Yes, B. Using of earmuffs. Sixth MCQ is in chemical factory, management has designed all precautionary measures for the safety of the worker. Most common form of skin involvement in the occupational setup is whether punctate ulcer, irritant contact dermatitis, painful burns, folliculitis, or stab wound.
B.
Yes, it's B, irritant contact dermatitis. That can be maybe due to the contact with the chemicals or with the some other object. Management of the factory XYZ has provided all the health facilities to its workers because they are concerned about the workers' well-being. Indicator of health status of the worker in an industry is whether accident books, recovery of the treatment costs, provided daily attendance record, clinical record of the worker, or the health dispensary.
B.
Yeah, it's the daily attendance record that we learned it in the heading of the sickness absenteeism. Replacement examination ensure that your prospective employee can safely perform the job they are applying for. One of the statement about replacement medical examination is not true, whether it is not done to assess the fitness of a person for a specific job, conducting only on those who are concerned with public safety, used for record keeping, gives baseline information of health, identifying any disease existing in life. This is the write-up.
B.
Yes, it's B. Conducting only those who are not concerned with public safety. It is not true regarding the pre-placement examination. Industrialization plays very important role in the economy of any country. Main aspect of preventing occupational health hazard is control of recognized hazards, screening of for disease, health education and safety training, environmental surveillance or the immunization. Main aspect of in every field
D.
of prevention is C, health education and safety training. By this method, we can prevent the injury. International Labour Organization, whose mandate is to advance social and economic justice through setting international labor standards. The main objective of ILO about occupational health is by the promotion of well-being, protection of workers, placing workers at appropriate place, providing treatment to workers, providing immunization to workers.
C.
It's the protection of workers is the main mandate of the international labor organization. Is the PF Mind Secure this is our YouTube channel. All the presentations are uploaded here. And thank you very much for today. Okay, Allah Hafiz. See you all soon.
Okay, Khuda Hafiz.